Thank you. Awesome. All right. Well, I'm really happy to be here with you today, Dr. Shahine. Dr. Lora Shahine is at Pacific Northwest Fertility in Seattle. And I know we've been in contact for it feels like a couple years now, but I've lost track on social media. It's been so great to be in connection with you and just be able to talk to you about some of the questions that my clients have when they come to see me and they've seen their fertility doctor. And one of the biggest things they ask me is they're seeing their OBGYN and they just don't know when they should move on to see a fertility doctor or what's also known as reproductive endocrinologist. And so I thought you'd be the great person to ask because you obviously know all these answers so intimately. So maybe I thought you could help us out with that.
That's great. I'm really excited to talk with you. And I do remember reaching out to you. I read your book first and realized, wow, I wish that I had this resource for my patients. And then I reached out and we've just stayed connected ever since. And it's such a wonderful resource for anybody thinking about different ways of building a family. And so I just really want to thank you for doing that. It means a lot.
Thanks for supporting me. It's so lovely to see how you're supporting patients on social media and getting that message out that you care. I mean, it means the world. And I've gotten so much feedback from my clients saying how much they love that. They really loved it. So.
Oh, thank you, Jana. And I really am so excited to address this really important topic because as a reproductive endocrinologist, I often see patients that I wish had come to me sooner. And I really want people to realize that it's never too soon or silly to see a reproductive endocrinologist. And I just want to clarify a couple of really important things. So all reproductive endocrinologists usually specialize in fertility, recurrent miscarriage, and first trimester issues. We've all done a residency in obstetrics and gynecology, but then have gone further to do a fellowship, a 3-year fellowship in reproductive endocrinology and infertility. So we're learning about hormonal issues like PCOS. We're learning about fertility issues, egg freezing. We do IVF. We help build families, and we do a lot of hormonal things as well. So it is a subspecialty beyond obstetrics and gynecology. So it's just important to understand that. And every obstetrics and gynecology residency program is going to be a little bit different, but I can tell you that I personally did not get a lot of fertility training in medical school or in an OBGYN residency. And so every gynecologist is going to be a little bit different. Some are going to be trained, some are going to have an interest in fertility and hormonal issues, and others aren't. So I think it's really important if you're having fertility issues or you have questions about your fertility, one of the first questions to ask your primary care doctor or your gynecologist is, I've had questions about this. Is this something that you are interested in talking about? Have you learned a lot about? And let's have a discussion and help me figure out if I should see a fellowship or a reproductive endocrinologist, a specialist.
Yeah. And what if, I think it's really hard for some women to tell their OBGYN that they would like to pursue more answers, especially if their OBGYN does tell them, it's okay, you can wait, no rush. And, maybe they're over 30 already. And I think they sometimes feel like they can't maybe speak up for themselves, or what do they do, in those situations? And I know that's kind of hard, but.
Absolutely. I do feel that sometimes primary care doctors or OBGYNs are really like the gateway towards specialty medicine. And everybody should really check with their own insurance about whether they need a referral or not. But nobody should ever feel shame in asking for more help or feel like they're going to hurt a doctor's feelings. If they have that kind of relationship with a physician and they don't feel like they can really tell them how they feel or question or take part in their own care, then it's time to get a second opinion and really look for another care provider that's going to listen and make you feel comfortable with your questions.
Yes. And I think that can't be stated enough. I think we're so used to listening to our doctor and not questioning one thing, and so it is hard for women to to pursue a reproductive endocrinologist if their OB/GYN has said, oh, there's no need right now. I think it's really important to trust your gut, your intuition as a woman. And if you have questions and just even want that peace of mind, to talk to a fertility doctor and I'm using those terms interchangeably so people know that a reproductive endocrinologist is a fertility doctor. So
in our, to make sure everybody understands, if you go to college for 4 years, then you go to medical school for 4 years, and then a residency is training in a certain field of medicine. So we do 4 years of training in obstetrics and gynecology. And then after that, reproductive endocrinologists do a 3-year fellowship in that specific field. And it's called Reproductive Endocrinology and Infertility. And sometimes we say REI, or sometimes we say RE, just to kind of shorten it a little bit. And so we really are learning a lot about fertility, and we're learning a lot about IVF. And that's why we sometimes are called fertility doctors. But we do get a lot of training in other endocrinology issues like premature menopause, polycystic ovarian syndrome, endometriosis and its ongoing care. So we're trained in a lot more than only IVF or only fertility, but every provider and every practice is a little bit different, and some focus more on the endocrinology aspect and some focus more on the fertility. We are actually the specialist in recurrent first trimester miscarriage. And so that's a really common misconception about who do I go to if I'm having multiple miscarriages. It's really reproductive endocrinologists that focus on first trimester complications. So that could be helpful too.
No, so good. And I've had many clients come to me and have their first miscarriage and just are distraught. And I send them, or I tell them about your book, Not Broken, because, if you've been through a miscarriage, and, a lot of doctors will say, try again. It happens. It's very common, but some women, just the idea of having another miscarriage is devastating. So if they know they can do more research, read more information, it gives them a sense of that they've been heard and that they're being listened to. If someone was thinking right now during this pause, they're home, they've been trying to get pregnant and they haven't seen a doctor yet, but they're really wanting to, are you doing these teleconsultations for new patients that may just want to talk to you about their reproductive system?
Yeah. Absolutely. I mean, I think that medicine is finally in the future, and we should have been doing telemedicine for a long time. The reason it's been so hard to implement is the insurance companies have really limited reimbursement for that. But with the COVID-19 pandemic and the real need to do telemedicine to care for people in a safe way, then the reimbursements have gotten a lot better, and it's opened the doors to a lot of consults for people that I wouldn't have been able to really meet with before. And our whole practice is doing it. A lot of people in the field are doing it. So it would really just take a phone call to the practice and see availability and what that would look like.
Okay. And then I think it would also be a great thing if somebody wanted to get a second opinion. Is that a way to talk to you about possibly a second opinion as well?
Yeah, absolutely. We're reviewing records and kind of looking through what's been done and what tests have been done. It can help guide people on different paths, and it really can be a useful tool.
Oh, that's fantastic. I can't tell you how many times someone comes to me and they've gone to their fertility doctor, they have a path, it's not working out, they don't know what to do, they sort of feel stuck. And they don't have access. So there is an opportunity in this moment to have access to doctors now all around the country, like yourself, who, are so good, trained and have a specialty in miscarriage, that if someone, especially someone who is experiencing early miscarriage, can reach out now to you, to your practice, and possibly set up a consultation. So that's wonderful, really is.
Yeah, there's a lot of, uncertainty right now, and there's a lot of grief. But it's nice to find something positive. Mm-hmm. We can talk about something positive is maybe more access to care, which is a good thing.
It's such a good thing, especially because we know this road can be long for people. they can be on this road for a very long time trying to get pregnant. So, well, thank you so much for taking the time to spend with me. I'm going to leave the cost and all. I know those will be questions, but just go ahead and make that phone call. I imagine if they call your front office, they can get that information from you if they want. So I'll leave that up to you to go ahead and give a call, but reach out to Pacific Northwest Fertility in Seattle if you'd like. And again, you don't have to be in Seattle to have a consultation with the doctors there.
Mm-hmm.
Yeah.
That's right. Oh, thank you so much for this opportunity, Jana. It's wonderful to connect.
Absolutely, it is. All right. It was great to talk to you, and we'll be in touch soon.
Perfect.
Bye. Bye-bye.